Dr. Tuteja sir to come on stage. Thank you, sir, for your presence. AHA has two very special orations. One is in the name of Dr. MKC Nair and Dr. Swati Bhave Madam. That oration we are having tomorrow. And today, the another oration of AHA is this Dr. Tuteja sir and Dr. CP Bansal sir's oration. We are really proud that all these four personalities have done so much for our AHA. We are in 25 years now, the Silver ADOLESCON we are celebrating today. It is all because of our past chairpersons and seniors. We have to accept their contribution to our academy. It was they who has really conceived the idea and nurtured our AHA. And therefore, we are seeing what is it today, which it has really branched out as one of the biggest chapters of IAP. Thank you, sir, for all what you have done for AHA. So I would like to say a few words. It's our privilege to introduce our orator today, Dr. Professor Amdekar, sir. We are very honored by his presence and actually humbled that he has accepted his oration this year. We all know him. Who doesn't know him? He's been a past president of IAP in 1995. And he's been a professor at Grant Medical College and Wadia Hospital. He was connected with these hospitals. And we all know him for his innovative programs and which draws so many pediatricians for any program he does. He really steers the programs, the steer programs which you all attended. He has, even at this age, he is more than 80 plus, and he goes around the whole country, and he does these programs just out of passion for academics. He's been so much passionate about his students, his mentors and mentees, that we all draw a lot of guidance from him, including me. I look forward for his guidance and support, and he's been very, very, really so supportive to many of us. So thank you that you have guided many of us in IAP, and also now we have got him here as a past president. I requested him to please accept so that we want this adolescent agenda to go into the central IAP, and we want all the past presidents of IAP to be the advocates for our AHA and adolescents. Thank you so much, sir, for accepting. This is a very short introduction, but is much more than that. And we have to give a big round of applause that he has come and accepted this oration. Thank you so much, sir. So I request you to kindly deliver the oration, sir. Before that, Dr. C.P. Bansal, sir, Tuteja, sir.
I will just say only one word, rather one line, that it's truly an honor for both of us that our oration is being awarded to someone. In fact, he has honored us by accepting the invitation. We are truly humbled. He is a teacher of teachers and a guiding force for generations of pediatricians, and including both of us. So with respectful regards, thank you so much, sir. Thank you is a very small word, but we have nothing else to offer our thanks, and thanks for accepting this.
I endorse the views delivered by Dr. C.P. Bansal. We are really honored by his presence and by the oration. Thank you very much.
The organizers of this conference, I'm very grateful for awarding me this oration. When I was asked to give this oration, I was wondering, what is my place in this adolescent group at all? I have hardly done anything for this group whatsoever. However, because of your insistence, I accepted it, and I'm very, very happy, and I'm grateful. Am I audible now? Fine. I'm grateful for all this honor, and especially this is the first oration I'm giving when both Dr. C.P. Bansal and Dr. Tuteja are right on the stage with me. I value that very much. Who doesn't know Dr. C.P. Bansal, a past president of IIP. But what is peculiar of some of us, Swati is here, Raju is here, many of them, we continue to serve IIP in one form or another, even without any position. And I'm sure the future presidents also must be working hard right before they even achieve a position. And I think this is one example. And look at Dr. Tuteja. Without any position, he continues to spread knowledge, brings down talk shows, and I'm very, very happy that I'm giving this oration on the name of Dr. C.P. Bansal and Dr. Tuteja. When I was asked to give this oration, I was wondering, what do I tell this group something new that they would not know? In fact, I would have learned a lot from this. But I'll just summarize what I know and what I feel thereafter. And I'm sure you will pardon me with some of the very basics that I start with, and all of you know it very, very well. I think this is a rough period, adolescence, with a lot of raging hormones, and we all know that there is a rapid physical, but also cognition, perceiving the world around them for the first time. And then, of course, emotional, establishing behavior pattern, and the social changes, very, very critical events that occur during this period. And I think that's where this period gains a lot of importance. This is a period of disorientation. This is the period of discovery, its self-identity, and finally independence. That's what the adolescent wants. Now there is a lot of shift from family to peer groups, navigating social relations, romantic interest, rebellious behavior, anxiety, insecurity. But what is most bothering an adolescent is he feels that he is being judged at every time. And I think that bothers him the most. And adolescents are not children. Children are dependent and they lack maturity. But they're not adults either. They have no legal rights, they have no legal responsibilities, and they do not know what is the societal expectation. And therefore, this is a very, very difficult period for an adolescent to go through. Did we all not go through the same adolescent phase? Yes, we did. But the environments were very different. The environments were not very challenging. There was already a lot of support, not only our parents, but even the earlier generations. And I think, therefore, we grew in a manner that was very conducive for going smoothly through that adolescent phase. Today, the things are changed, and therefore, the adolescents have a lot of challenges to meet. And I think we need really a multifactorial approach to the adolescent health. And to that extent, we all know that we need to look at them as individuals. We look at the family, of course. We go beyond that, and also in the school or even the community for that matter. And I think providing comprehensive care, I must remind every one of us that it does not start at adolescent nor at pre-adolescent. It starts right from early childhood. And therefore, we need to go back that far to consider how we are going to develop an adolescent well. And it's not at the last minute that you wake up and say, look, you're now an adolescent, what more can I do? And we know all this. Just now also I was hearing Dr. C.P. Bansal, who summarized all this so well, that there are physical issues, nutrition, exercise, habits, sleep, whatever he said right now. Development, for example. I think navigating independence of this period, making decisions, healthy choices, building strong relationship. What about intellectual? Fostering the conversation, active listening, problem solving. I think these are the issues that we must start developing right from early childhood. Then only you can take them further up. And then, of course, the mental, the stress management to prevent anxiety, depression, eating disorders. I know every time I see a child about 9, 10 months old, I tell the parents the first thing that you should teach them is what is no. And I think that is very, very important. And at that stage, we say, oh, don't throw this. But then we clap when he throws. So he's encouraged to throw again and again, and we keep on saying, no, no. He understands no means encouragement. Continue doing so. I think these are all the things that we start right from very early age. And then, of course, the social and emotional, body image, self-esteem, minimal screen time, engaging in meaningful activities. These are all to be developed right early. And of course, one more issue, ensuring safety during this adolescent period. And some ideas come up very early in life. Reproductive health, of course, prevent violence, substance abuse, exploitation. This morning I was listening to some of these issues. Now, in all this, we know that it's a comprehensive health care which starts from early childhood. But of course, the role of parents is so important in all this. Now, parenthood is not just a biological relationship, but refers to the intricacies of raising a child. And I think that is what the parents have to know. And I'm sure we all know that we need to have an authoritative parents who have a high responsiveness and a moderate control as well. Now, what is important really is that these parents need to prepare for adolescent healthcare in early childhood with positive experience. And what do the child needs at that time? A safe and loving home environment, the opportunities for exploration and encouragement for curiosity. I remember when we were small children, even a telephone was not a common thing in the house. And the adults would say, whenever it rings, don't touch it. It will fall down. Okay, today, of course, the children can teach parents how to do all this. That's a different thing. So we need really to give them a lot of encouragement. Let them be curious enough to kind of find out how this world is really going to move. And I think ensuring healthy lifestyle, that's the role of the parents. The physical, mental what? Happiness, positive attitude, and coping with stress. I remember a small mosquito was born, and it was his first day of flying all over. It flew all over and came back in the evening. The parents asked, how was it? He said it was excellent. Everybody was clapping. What a positive attitude, right? I think even that small mosquito has a positive attitude. He doesn't know when he will be killed totally. That kind of a positive attitude, and I think all this really comes right from the beginning itself. Then, of course, the emotional mind control to face many adversities. A child must know that everything that he wishes will not happen. And even if it doesn't happen, nothing goes wrong. He needs to understand how to tide over those unhappy moments. And I think this must be taught, and therefore they must be encouraged to face such adversities and even know how to cope up with it. And I think each of these part of the health is extremely important. Social, of course. You must have a relationship with others, family member. I remember as a child when I had my grandparents also in my house. At the end of the day, we used to have a dinner together, and my grandfather would say, everyone will say how the day went on. It was an excellent way of interacting with each other. Okay, even as a small child, I had to say how my teacher foolishly said something, how my friend bullied me, whatever it was, but it was a social interaction. Today, we know that a social interaction should start right at birth, and that's our culture. Whenever I've seen my grandmother doing, my mother doing, my wife doing, when a baby is born, you give a massage, you give a bath, but while doing that, you talk to this newborn, and the newborn understands. Newborn understands that somebody is having a relationship with me, bonding with me. And I think we feel, what does that newborn? But the mother talks as if he understands everything. and he really reciprocates as the age advances. Our social interaction starts from day one. And today the development specialists tell us that that is the beginning of, if you don't follow it, you will end up with an autism. So it's not that at 1 year you look at him and say, oh, does he wave bye-bye? Okay, when you call him, does he listen to you? Oh, that's too late. And to prevent that, you need to be right at birth. That interaction is very, very important. And I think earlier when we grew, there were many interaction opportunities. There were too many people in a small house. There is a big house with small number of people. Okay, and the only interaction is an unilateral one-way interaction with that electronic media, the TV, the cell phone, and that was being discussed all along. And I think this is important. But even the last thing, the parents should take also the care of a spiritual health. What do you mean by spiritual health? We know Kama, Krodha, Lobha, Moha, Mada, Matsar. These are the enemies of the mind. And let the child know that while we may not be able to achieve all this, we are not saints, but we try to achieve them. And when we fail, we remind ourselves, well, you failed again, don't fail tomorrow. That's fine. Even that recognition becomes very, very important. And I think having said all this is the role of parents. The problem is, are parents trained? That's a bigger problem. And is it natural that you become a parent and you know all this? No. We had to learn all this after joining medical college and doing post-graduation. Poor parents know nothing. And I think then what is happening is that every time you buy a new equipment, there is a brochure with it. This God doesn't send any brochure at all. And why does he not do that? He knows that there are pediatricians. When they see children, they will train parents. But poor God, he did not know how we can even go beyond that. And I think that is the challenge today, that who will train them? Therefore, when they become an adolescent and they start posing a problem, and that's the time we wake up and say, oh look, there have been problems. These problems could have been prevented had pediatricians talked to them. And we have a lot of opportunities. We don't go through that. And therefore, the role of pediatricians are doing all this. And I think we are health promoters and not disease managers. We must know that very, very well. I must have said it umpteen number of times. But after all, the diseases can make us get opportunity to talk to parents. But today, we all do preventive health. They come for vaccine. But what is preventive health? We are vaccinators only. Do we see the growth? No. Do we see development? No. Do we have a growth chart? No. Do we talk of nutrition? No. Forget the comprehensive health. We only give vaccines and we say that's a preventive method. Now these are the facts of life. And I think therefore we need to know that we are health promoters. We need to be proactive in training parents. He may come for a routine vaccine, but you find that parents are probably ignorant enough, and therefore you need to broach the topic of how they're going to do and raise this child normally. And I think this is very, very important part of our, it starts, adolescent health monitoring starts right from then, and I think that is important. And these preventive health measures must go through. Well, parenting is a crucial factor for adolescent development. And I think high level of warmth and monitoring from parents have a significant impact. We need to talk to parents about this. They are responsible. Even in routine practice, when I treat a patient, even of simple fever or a viral infection, it's the mother who is treating the child under your guidance. If mother doesn't know how to do that, what is the use of your knowing and your prescription? Therefore, again, I think we need to see that the parents understand what their responsibilities are, and that is our responsibility. So training parents in person is a very time consuming. But there are methods. I remember late Dr. Merchant always said that one who is very busy have enough time. I asked him, how is that? He said, no, he can manage time. So anytime somebody came late and said, sir, I'm sorry, I was busy. He said, no, no, don't say that. If you're busy, you would have come on time because you know how to manage time. This is important, and therefore, do we have time? We will have to create time. Every one of us has 24 hours. Okay. Can you not give the last half an hour or 1 hour only for a child whose parents need a lot of time to discuss issues? If you are having an asthma clinic, each parent of an asthmatic child needs 45 minutes to 1 hour to explain what is asthma, what is inhaler therapy, how to implement it. Can we not have one last half an hour or 1 hour out of your whole situation and say that, look, you come at that time, I need to have time with you. If you have a commitment, if you have a passion, everything is really possible. However, I know that it is not easy for many. And therefore, we must have a group activity. At least maybe at a particular time, maybe Saturday afternoon, evening, you can call a group of 10 parents and give them an idea how to raise a child. They are all new parents. They all have small infants. And group activity can be considered. And I think these are all important issues. I remember Dr. M.K.C. Nair used to have such groups for the adolescent care, etc. Some of you may be knowing. And he told me 3 decades ago what happens in such groups. He would have a group of 10 parents of adolescent children. And he would tell the parents how to talk about sex education to their sons or daughters. And he would give them an idea how to go about it and call them a week later to report how did they fare. And one of the fathers came back saying that every day he could not get courage to talk to his son about sex. Till Friday came, and a Saturday was the reporting time. So Friday he developed a courage, and when his son came from his playground activities, and he said, son, sit down. I want to talk to you. So the son asked, what is it about? He said, it's about sex. He said, Dad, any problem? Now, he did not know how to proceed further. He knew theory well. He had learnt a week ago, but he did not know what to answer. I remember this story with M.K.C. Nair told me, and I realized that they are ahead of us. So you need to start from the earlier time itself. And I think, therefore, specialty group may be another idea. But I saw in the Western medical practice, in everybody's clinic, when the patients wait outside, there are brochures kept there. You just pick up something. Today, everybody has a cell phone. You can even just take a copy. And that's not a bad idea. If all of us put some such literature, after all, many of them have to wait for a long time. And I always felt that the doctors have no time to see the patient. It's only the patient who sees the doctor. Doctor doesn't see the patient. So when they're waiting outside, they could at least go through some such leaflets, and I wonder whether the adolescent group can prepare such and just spread it across. Let them be there. Maybe out of 10 parents, 1 or 2 will pick it up, and they might get the knowledge that we want. And I think there are many, many such ways of disseminating information which we already have. So I thought that it's good that we have specialists now, and specialists, subspecialists. That's a very important thing, but the basics still remain. And to that extent, we need a T-shaped specialist. What is T-shaped specialist really? A depth in one specialty, but a breadth in general pediatrics. And I think that breadth is lacking today. Okay. So we need that there. Well, ideal type is a key-shaped specialist, which means he has an expertise in multiple fields, but that is too much to ask for. And I think that is what we are lacking today. So all of you as adolescent group and interested in promoting adolescence must be a T-shape where you have a good breadth as well. And what is that breadth? Start from the infancy, start from the newborn, and then build up. Today you have a specialized way of doing it, and I think that is very, very important. Quo vadis is a Latin term which says, but where are we going? And let me put up some thoughts of where we are going today on all this. I think most of us function as first aid disease managers, not even disease managers. How many of us write a diagnosis on our prescription? Hardly any. Why? Because we don't have one. But could we write that no diagnosis, then no prescription? So to write a prescription, it's better don't write a diagnosis at all. So you write a name and a prescription. We start from there. I call it a first aid management of disease. Literally that. And I'm sure that majority of us do that. We don't even write notes, forget notes. We don't even write. But if you start writing it's a viral infection and write an amoxicillin, your at least hand will shake, but if not hand, your mind should shake. And that's why you write viral infection, so that your hand shakes and does not write an antibiotic. And I think this is very, very important because we seem to have vaccinators more than anything. And I think we hardly do therefore preventive thing. We don't give even any advice on nutrition, growth development. My group has created a 3-hour model on how growth chart alone can give us a diagnosis. That's the power of growth chart. And I'm afraid where even a 5% of pediatricians have a growth chart. Most of them have a growth chart, but they are not charted. Few of them chart, but they are not counseling parents. But even if you chart, the parents will ask you why this line is going down or up. How many of us have a growth charts in our practice? I shudder, very few. Right? Good. And I think unless we are committed to that, otherwise then we are a general practitioners for children. Worse than the general practitioners who look from newborn to the old. We look a small segment and even then we are not complete. And I think that is important. Just a drug prescription, no documentation of clinical diagnosis, minimum communication, and no counseling at all. Are we able to counsel difficult problems in a simple terms, communicate them? For example, you have a neurodegenerative disease. How do you communicate? How do you counsel? And in adolescent group, that is extremely important because the problems need a lot of skills of communication and counseling. And I think it's not only the adolescents, for even simple thing. When a child came during the COVID pandemic with a simple fever, and I knew it was of some viral infection, but she was worried whether this could be COVID and her child could land up in an ICU and may never return. Her mind has that kind of a worry. And for you, it's a simple viral infection. Take paracetamol, you will be all right. Would you not be counseling and treating the mind of the mother who is worried whether her son will be in an ICU? That's what she's reading in the papers. But if you happen to tell her that, yes, you must be reading all this in paper, but have you seen children going to ICU? No. Why? Because children are absolutely naive, okay, and they hardly suffer immune complications. So don't worry. I have not seen any child who has required an ICU. That is touching the mind of the mother. And today science knows that if mother has a good faith, she's calm and quiet, she has been well counseled, that transmits to her ailing child. And the child's immune system really works in favor in a right way to cure. And I remember Dr. Adole, one of our senior teachers in Mumbai, had a prescription paper always up there, I treat, he cures. Today I know that we can help the mother to cure the child. And science knows that if your mind is strong and if your mind is convinced that this doctor is saying something and he is bound to make my child fine, I think the immune system works in favor. And I think this is very, very important for us to really take a note of that. So can we reverse this trend? We all know that we are not doing what we should be doing. Well, to which we say everyone is doing the same. Yes, I know that. But if everyone starts doing something, others will also follow. It's up to us. We are educated people. We are highly qualified people. We need to be commitment, and following all this is extremely important. And therefore, I think we need a change of attitude. Now, what does this attitude really mean? To me, it's a triad of first belief, which develops an action, and that ultimately has an outcome. For example, I believe in God. That's my belief. Who has seen God? But I believe in God. My action, I pray. And my outcome, I am happy. That's an attitude. So everywhere, if we work in that same way, I believe I must do something more to this parents for the child. Then the action is, I commit to transfer all my knowledge and efforts for the child to grow well. And the outcome, when the child gets better, the parents give you blessings, which is not available anywhere. I remember a multimillionaire, almost on the deathbed, called all his assistants and said, you find out how I can transfer this money up to the heaven. Because I've got a lot of money, I need to transfer. He asked all his fellows. They said, no, but there is no way. One of them said, no, there is a way. But give me time to think, and I will transfer all your money and assets up to the heaven. Next day he came and said, yes, there is a possibility. He said, but we will have to turn all your assets and money into that currency. Yeah, you go to US, you need to have dollars. You go to UK, you have to pounds. So their currency you need to transfer. He said, please transfer. He said, no, their currency is blessings. How many blessings did you have? Unless I change the currency, I will not put it in. I think that is exactly what I said, that we need really to desire to excel and exclusive of awards, but inclusive of own happiness. And I think if you look at the word attitude, and if you give a numerical number to each alphabet, A is 1, B is 2, attitude is the only word which totals 100. And attitude takes you to altitude. And I think therefore we must develop that kind of an attitude. And as I said, that finally it should be inclusive of happiness. What is happiness? Is success a happiness? No. The success lies in happiness. And what is success? There are many authors who have defined success in different way. But Robin Sharma, who has written a book on about the saint who sold his Ferrari. Now he writes the best definition of what is success. And it shows me that success lies in happiness. He says that success is an unintended side effect. Unintended side effect of any act that you do for someone else other than yourself. What a wonderful, wonderful thing. And I think that is the happiness that we need to get. And finally, a role of organization. Ours is an organization. For example, we have an Indian Academy of Pediatrics. You know what is academy? Academy is the school of special training. So what are we doing as IIP? We are giving special training to those who are qualified pediatricians. And what is this special training? Reminding them that you have to do much more than your medical knowledge or prescriptions. That is academy. Don't you think all of us should be academics first? And our leaders should be academics. Then only the academy will prevail. Okay, and I think therefore the role of organization is very important. The success and functionality of any organization depends on individual members, not the president, vice president, secretary, no, individual members. And I think their expertise, their perspectives, their skills, their efforts, who is going to do that? The leaders of the organization. That's the capability of a leader. And to that extent, each member has a role, big or small, and it results in a collective output. Do all of us as members have some responsibility? Yes. I want to do something, but I don't know what to do and how to do. The leaders will have to guide that, and I'm sure there are enough number of members who are ready to do all that, but they don't know what to do, and many times they don't have an opportunity to do. So you need to create an opportunity. So organization must foster and nurture a positive environment, motivate the members, and help a change in attitude. I think today the member who is in some small area, in a small place in a district, is as good as any one of us, but he has not had opportunities. Should the organization not take care that he would have those opportunities? And I'm sure there are a lot of talent spread all over, which are invisible to most of us who are sitting in some big cities. And I think that is where possibly the organization should take care of that. We need to develop a mission. And what is mission really? What we want to become. What is IIP's mission? To make every child in this country healthy and well-being of a child. That's the mission. Then what's the vision for it? What is the vision? How to kind of achieve that vision? And if our IIP's role is really to look after every child and make him healthy, then how to achieve it? It's the only way we train our every member to help us achieve that. So there again comes the role of an organization. And what is our objective finally? What is our goal today? The specialty group like yours, Adolescent, your aim is to see that adolescents go through that smoothly, that rough period. And for which we need to start right from the beginning. And I think therefore you have to have a monitored, time-bound program. And if you look at that, then there is no substitute for such a model. I'm sure all of us have seen IIP growing and certainly doing wonders, but none of the projects have continued to end with the final goal that we wanted to achieve. Well, if breastfeeding group is after that, they should achieve breastfeeding to an extent that we say, yes, we have done it. Same thing for each one of the group. I will just end up with a take-home message. We are responsible for monitoring growth, development, nutrition right from the beginning of life to the completion of transition to adulthood. And therefore, we all have to be good general pediatricians to further branch out to specialties, be it neurodevelopmental, be it adolescent, but the whole thing should start right from there. There are plenty of opportunities during earlier years, regular visits, vaccination, also during frequent illnesses. This is the period to train parents, one-on-one basis, and to sensitize them to watch for any deviation in a later life. And training during the pre-adolescent phase. Just now, Dr. C.P. Bansal talked about pre-adolescent. He said, don't wait for adolescents to come. And I think it should be a group activity based on standard methodology formed by the organization. I end up thanking you, all of you again, and I wish we make it.